Good day, ma'am, and to each and everyone. So my name is Eliza Cristoco Ferris from BSN 1A of Iloilo Doctors College. And for today, I'm going to perform a demonstration in assessing of eyes. So prior to performing this procedure, we need to, of course, perform hand washing or hand hygiene or don our PPE if there's necessary. So I have here an alcohol that serves as my sanitizer. And it is also important for us to prepare all the equipments needed for the assessment. And the next thing that we're going to do is to proceed with the assessment properly. Hi there, ma'am. Good day. How are you doing?
I'm fine. Good morning.
Okay, that's great to hear. So, by the way, my name is Eliza Cristoco Ferris, and I'm your student nurse for today. So, can you kindly confirm to me your name as well as your date of birth, please?
Kaya Parcon Cofreros, November 6, 1971.
Alright, so I think we're good in here. So, thank you for that. So, what would you like me to call you, ma'am? Is it by your first name or your last name?
First name, please.
Okay, thank you for that, ma'am.
Welcome.
Alright, so the first thing that we're going to do is to identify our patient. So this is to ensure that we have the right patient in front of us. And it is also important to establish rapport and introduce ourselves towards our patient. So if there's any curtains or doors within the area, we need to close them in order for us to provide privacy to our patient. And the next thing that we're going to do is to position our patient in the comfortable one and to explain the procedure. Alright, so ma'am, are you in your comfortable position right now?
Yes, ma'am.
Okay, that's good. So, by the way, I'm here to perform the assessment of your eyes. So, why do we have to do this? So, this is to ensure that everything is normal. And if there's abnormalities that occur in your eyes, just like if there's any discoloration, if there is a swelling or lesions, or if there's abnormalities in the size of your eyes, and if there's any signs of blindness, so we need to take note of them in order for us to prevent further complications. So do you have any questions to that or any clarifications?
No, ma'am.
Alright, so if there's none, we're going to proceed then. So but don't worry, ma'am, if you do have any questions all throughout the assessment, you do have the freedom to do so, okay?
Okay.
Alright, thank you. So the next thing that we're going to do is to proceed with the first procedure that we're going to do, which is what we call inspection. So what are we going to inspect first? So we are going to inspect the eye position and alignment of our patient. Alright, so ma'am, can you please look straight ahead? Okay? So as I'm inspecting my patient's eye position and alignment, there are no abnormalities that occur, which is normal. That is good. So the next thing that we're going to inspect is the eyebrows as well as the eyelashes of our patient. So in here we are looking for any distribution, if there's any abnormalities in the distribution of the hair of the eyelashes as well as the eyebrows. Okay, so far there are no abnormalities that occur. And the next thing that we're going to do is to inspect for the lacrimal apparatus. In here, we are looking for any swelling, if there's any redness on the lacrimal gland of our patient, okay? So far, there are no occurrence of abnormalities, and that is good. So the next thing that we're going to inspect is for the sclera, lid, and conjunctiva of our patient's eye. Right, so ma'am, I'm going to look at here in your eyes, okay? So as far as I'm assessing my patient's sclera, she has a white and shiny color, which indicates that that is a good result. And on her, okay, so ma'am, I'm going to depress your eyelids, okay? And ask you to look up for me, okay? Alright, so as I'm inspecting my patient's conjunctiva, so she has a pale white color. So which indicates abnormalities on the conjunctiva of my patient, which indicates the anemia or lack of red blood cells. So we need to take note of them. So the normal color for our conjunctiva is pink. So the next thing that we're going to do is to inspect for the iris of our patient. Right? So my patient's iris has a round, flat, and evenly colored, which is normal. And if there's any irregularity in the size of the iris of our patient, we need to take note of them. And the next thing that we're going to check is the cornea as well as the lens of our patient. Right, okay. Okay, so far there are no discoloration or irregularity in the size of the cornea and lens of our patient. So the next thing that we're going to check is for the pupil of our patient. So normally the size of the pupil of a pupil is 3 to 5 millimeters. Okay? Alright, so I'm going to inspect it your eyes, ma'am. Look straight ahead, please. Okay, so far there are no irregularities on the size of the pupil of our patient, which is good. And next is we're going to proceed with the next procedure, which is what we call palpation. So what are we going to palpate here? So first we are going to palpate the bony orbits of our patient's eye. Okay, so in here, ma'am, I'm going to palpate here, okay? So you're going to tell me if you feel any hurt or any pain as I palpate them. Do you feel any hurt?
No,
Any
ma'am.
pain? Okay. Alright, so far there are no abnormalities on her bony orbits. So the next thing that we're going to palpate is the eyelids as well as the eyeballs of our patient. So in here, I'll be needing a stick on here and check at the bottom or upper part of the eyelid if there is any foreign if there is any foreign bodies, any swelling or any redness on the eyelid of our patient. So far there are no occurrence of abnormalities, which is good. So the next thing that we're going to palpate is the lacrimal apparatus of our patient. So we're going to palpate here the lacrimal gland of our patient. Okay. So can you please tell me, ma'am, if you can feel any hurt or any pain? Do you feel any pain?
No.
Alright, so the next thing that we're going to do is to proceed with the special test. So first of all, we are going to position our patient 2 feet away from our testing area. Okay, ma'am, so I'm going to move you away so that we can test your visual acuity using this Snellen's chart, okay? Alright. So the first thing that we're going to test is the visual acuity for patient. So by the use of the Snellen's chart, and of course we have to use an opaque card in order for us to make it cover to the other eye of our patient. Okay, so I'm going to ask my patient to cover other side. Ma'am, can you please hold it for me and cover your one eye? So I'm going to point out a letter here, and you will going to tell me if what letter can you see, okay?
Yes, ma'am. E. T. E. E. D. O. P. E. It's not so clear for me, ma'am. Sorry.
Okay, so it seems that our patient has a hyperopia, which indicates a farsightedness. And I also observed that my patient has an behavior of leaning forward as well as the tilting of head. So thank you for that, ma'am.
Welcome.
So in checking for the visual acuity, we are looking here for normal vision, if there's any sign of myopia or the hypoxia. So we need to take note of them if there's any abnormalities. Okay, so the next thing that we're going to check is for the visual field. So here, we are going to ask our patient to cover eye using the opaque card. Okay, ma'am, can you please hold it for me and cover your one eye, okay? Alright, so you are going to follow my index finger as I'm going to move it from the middle up to the side, okay? Alright, so focus on this index finger, ma'am, okay? Alright. Can you please move your opaque card on the other side of your eye, okay? Remove. Alright, thank you for that, Ma'am Fe. So far, there are no involuntary movement or shakiness on the eye of our patient, which is good. So the next thing that we're going to inspect is the cover and position test. So I'm going to ask my patient to look straight ahead for me. Okay? And then, Ma'am Fe, I'm going to I'll just focus on the direction on the straight ahead, and I'm going to cover it for a few seconds. Right, so as I uncover it, the eye should be remain at looking at the straight forwards direction. And as I'm inspecting my patient's eye, she has no abnormalities in terms of the head position of the eye position of our patient, which is good. So the next thing that we're going to inspect is for the extraocular movement. So in here we are testing for the extraocular muscles. Okay. So Ma'am Fe, I'm going to ask you to please follow this index finger as I'm going to position it in a different manner, okay? Great. Alright, this side as well as this side. Okay, so everything is normal and my patient has no occurrence of abnormalities as I'm assessing for the extraocular movement. So the next thing that we're going to test is the convergent test or the accommodation test. So in here, I'm going to ask my patient to focus on the index, on my index finger or my examine index finger, and focus it as I'm going to move this index finger towards her nose or in the forward direction. Okay, focus on this index finger, ma'am, okay? One more time. Right. So far, my patient's eye has a normal movement as I'm assessing for the convergence test or accommodation test. So the next thing that we're going to check is for the corneal reflex. So in checking for the corneal reflex, we will be needing a cotton ball in here. Okay, and we're going to twirl it at the end of it and apply it to the cornea of our patient and ask the patient if he or she can feel the cotton ball and observe for blinking sensation. Okay, Ma'am Fe, so can you please widen your eyes for me and look straight forward, okay? Okay. So as I'm doing the procedure, I'm going to dispose the cotton ball first. So I'm doing the procedure. I observed that my patient has a blinking sensation. So I'm going to ask my patient if she can feel the cotton ball as I apply it to her cornea. So ma'am, do you feel the cotton ball as I applied to your cornea?
Yes, ma'am.
Okay, thank you. So it indicates that it has a normal result, and the next thing that we're going to do or to take a test is the direct and conceptual of light reflex. So in here we will be using our pen light and testing if the pupillary response has a constriction or there are no constriction, which indicates abnormalities. Okay, can you please look straight ahead? Okay. Okay. So as I'm assessing my patient's eye, the pupillary response has the pupillary reflex is constriction, which is normal. So the next thing that we're going to test is for the visual function. And in here, we are going to ask our patient to if she can, as I'm going to move my hand, if she can see my fingers. So Ma'am Fe, I'm going to wave here my hand and tell me if you can see my fingers, okay?
Yes, ma'am.
Can you see my fingers?
Yes, ma'am.
Alright, so that's good. And the next thing is we're going to check for the light perception. Alright, so can you please look straight forward for me? Alright. As I am applying the light earlier, ma'am, can you see the light?
Yes, ma'am.
Alright, so that's good. So there are no indication of or any signs of blindness, which is good. So the next thing that we're going to test for the visual function is if my patient can count my fingers. I'm going to perform here. Can you tell me, ma'am, how many fingers did I perform
3.
here? Alright, that's good. So as I'm testing for the visual function, everything is good, which is normal. So the next thing that we're going to test is for the cranial nerve number 7. Here we are going to test the strength of the eyelids of our patients as well as its eyebrows. So Ma'am Fe, I'm going to ask you to close your eyes please for me. Remain your eyes closed while I'm trying to forcefully open it, okay? So I'm going to check for the strength of your eyelids. Okay, so as I'm inspecting my patient's eyelids in terms of its strength, there are no abnormalities so far, and that is good. So we are done on inspecting or assessing the eyes. But before that, we are going to position our patient first into a comfortable one in order for us to end the session. Okay, ma'am? Alright, so we are done, ma'am, in assessing of your eyes. So thank you for your cooperation.
Welcome.
Alright.
Thank you.
You're welcome. Thank you. So before we end, we are going to, of course, perform hand hygiene. And then document all the findings. And that's all, and thank you.